I want to be clear that we will not be able to open Oregon quickly or in one fell swoop.
To safely reopen Oregon, the governor and public health officials said Friday anyone who needs a test should be able to get one, and people living in vulnerable group settings need access to.
Testing and tracing serve two purposes. First, to diagnose those who are sick, and second, to see where the virus may be hiding.
Every hospital and every pocket of the state will work together to increase testing capacity.
And as the capacity is increased, we've expanded who should be tested and are now recommending to providers that if they see someone in front of them with mild symptoms of COVID-19, that they test that individual.
The final piece of the puzzle: ongoing, widespread, randomized testing. This is where a new partnership with OHSU to randomly test 100,000 volunteers comes in, called Be the Key.
This program is a game changer. It will give us a more accurate understanding of the true rate of infection in Oregon and to have ongoing precision monitoring of any new outbreaks.
On top of testing, people who are sick need to stay isolated. And if someone may have been exposed to the virus, they need to know.
This is called contact tracing. We contact trace in order to contain the disease from spreading quickly and widely.
At least 600 more public health professionals around Oregon will be trained up. They'll be of different backgrounds to reach communities of color and tribes.
Make no mistake, physical distancing will remain a part of our daily lives until we have the security of a vaccine or treatment for the disease.
But she says parts of rural Oregon, where they've reported no cases or few hospitalizations, can likely start reopening May 15th. While Oregonian sacrifices flattened the curve, public health officials say our work is not finished.
If we move too quickly in resuming our pre-COVID-19 lives, we put ourselves at increased risk of a secondary or a second wave of infection.
Morgan Romero, KGW News.